Hello everybody and welcome back to the Non-Surgical Clinics vlog. So I hope you've enjoyed what we've done so far, and there's so much more that we'll be able to do, especially as you start getting to know me and ask me to do things. So today what I'm going to do, before we go into treatments, I'm going to talk about the side effects of fillers. And I might miss some of the smaller ones just because they're hardly ever seen, but I will cover the really big ones that you have to consider. And there are concerns with fillers that you have to think about. Now, I'm going to caveat all of this with the fact that hundreds of millions of fillers are done around the world every year. So even though the side effects that I'm going to talk to you about or reactions sound really scary, and of course they are if they happen to you, they still are really rare. So the likelihood is that if you have a filler treatment with somebody who's really competent, it will go swimmingly. So to start with, I'm going to divide the side effects that might happen with a filler into two areas, because you have practitioner-based problems, so problems that happen because your practitioner hasn't done it right, essentially, and then filler-based problems that happen because of the filler. So it doesn't matter how well the person who puts it in does it, the problem has arisen because of the filler. And really, that's a really important point, because what you do need to know when you embark on something like fillers is that nothing is risk-free. So even though choosing a really competent and experienced practitioner is important, at the end of the day there are some inherent risks with fillers that you can never escape, however well it's done. So let's start with the practitioner ones, because they're smaller, I guess, in terms of the list, and we can talk about those first. So what you must remember is that when you have a filler done, something, a foreign body, in the form of a gel usually, is being injected into the skin and placed under the skin. So what you need to know is that your practitioner has been trained, that they've got lots of experience, and also that they are qualified to deal with a problem. And this is number one. And I say this because in order to deal with a problem with filler, you need to have on site, on hand, something that could dissolve the filler. So if when I'm injecting a filler, I suddenly see that there's a problem, I think that it's placed wrongly, I think that it's blocking a blood vessel, I get my hyalase, which is hyaluronidase. Hyalase is the brand name, which is an enzyme that dissolves hyaluronic acid fillers, and I get rid of it super quick. And that's really important. And why I'm stressing that is that is a prescription only medication. So it means that anyone who is not a doctor or a dentist or a prescribing nurse who can prescribe can carry that in their clinic and prescribe it for you. So I quite often see people who have problems, not with fillers that I've done, but with fillers that other people have done. And I always ask the same question: why have you not gone back to the person who did this in order to get them to correct it? And they say, because they don't have the enzyme in the clinic, they can't use it. And what that means is it's a beautician or a nurse who isn't a prescriber who does not have prescribing rights, and they can't prescribe it. And that, in my view, is negligent. I actually believe that if you do not have hyalase in your clinic, you are practicing in a way that is negligent, because some problems, and I'm pleased to say I've not had this in my clinic, but I am prepared for it, some problems need immediate dissolving. So if you think you've blocked a blood vessel, you would need to dissolve it super quick. So first of all, find out if the person who's doing your injecting is a prescriber and a medical professional. Find out if they have hyalase in the clinic. Number one. Okay, that's my rant. So what are those problems that, aside from needing hyalase immediately, that a practitioner can have? Well, it's really important to know that different fillers need to be put at different depths, and they also need to be used in different parts of the face. So for example, you wouldn't use a really heavy filler, a thick bulgy filler, these are not technical words of course, in the lips, just to give you but one example. If you were injecting under the eyes, you wouldn't use a heavy filler. Again, you'd need something light. So you need a practitioner to put the right filler in the right place. So that's problem number one. If they use the wrong filler, or they put it in the wrong place. So for example, you can get lumps and nodules because a filler has been put too close to the surface of the skin. So there's another practitioner problem, that they're putting either the wrong filler in the wrong place or the right filler in the wrong place. So it's right for other things but not where they're putting it, or they're putting it too high or low in the skin. Then of course they're using a needle, so they're going into the skin and they don't know what's underneath, or they can't use their x-ray vision to see what's underneath. So you need somebody who knows the anatomy of the face, that they have a broad knowledge of what arteries, veins, etc. run where, nerves, big nerves, where the orifices are, where nerves come out of or go into. And in knowing those things, when they inject you, they can do their best to avoid it. Now I say do their best because we're human beings, and unfortunately we don't all follow the textbook. In fact, there is massive variation. So you also need a practitioner that knows how to suddenly change what they're doing because they've noticed a reaction, they've noticed your reaction, and they've realised that actually that's not the best place for them to put their filler. So you need someone who knows their anatomy and who can actually change tack as well. So the practitioner problem that we're talking about here is actually a practitioner that might hit a nerve, block a hole where the nerves come out, or block an artery, and that's the most serious one. So it's really important that your practitioner has, again, a medical knowledge and understands what they need to do. Again, practitioner needs to judge you, needs to know that what they're doing is right for you and doesn't contraindicate any other medical conditions that you might have. So they need to know their medical history, and they know what need to know what interactions might take place. I think that's really important as well. They need to know you're not pregnant or breastfeeding and things like that. So in the main, those are practitioner issues, and they're the most serious ones. You do not want an artery blocked. You don't want lumps or nodules because they're injecting it too superficially. You don't want any interactions with anything else that's going on. You don't want your nerves cut necessarily. So that's really important. They also need to know when to use a cannula and when to use a needle. So going around the eyes, for example, you'd preferably want them to use a cannula because it's safer. So it's just about knowing that your practitioner has the experience to know what they are doing. The practitioner also needs to know how to deal with problems, as I've already mentioned. So, for example, we talked about placing filler too superficially. There's an effect called the Tyndall effect, and this is when a filler is placed too close to the surface of the skin and the light then reflects through the skin back at you. So we quite often see this here in the tear trough, and you get a bluish discoloration there, and that would need to be either massaged very heavily or dissolved. So that again is a practitioner issue. And you also, if you place it too superficially here, which is the temptation, can get lumps. Again, a practitioner problem. So those are practitioner problems. So let's go on to problems with filler themselves. And as I've said, I'm going to go through a few things now, some of which are really quite scary. So don't be stressed. The chances of these happening are very, very small, but you do need to know them because you need to take an informed decision about whether you want to have fillers. So the kind of things that are described are acne-like skin eruptions. So over the area where you've had the filler, you can get almost what looks like acne. Now it may settle in time, you may need to have the filler dissolved. I've actually only seen it once, and I'm not even sure it was an acne-like reaction, but I did some skin boosters, very superficial fillers on somebody, and there was a bit of scabbing above it which fell away, but then it healed completely and we didn't dissolve the fillers. But that can happen, and it's almost a reaction to the filler. Asymmetry, I should have put that in practitioner problems really. It will be on your consent form, but obviously asymmetry can happen if the practitioner just doesn't put the filler in a symmetrical way. So it is a practitioner problem. Sorry for jumping. Okay, bruising, bleeding, swelling. I think with all fillers you can expect a degree of swelling for sure, sometimes bruising, and it can never be predicted. If the bruising was really bad, you'd get what we call a hematoma, which is a collection of blood under the skin which can take quite a few weeks to go away. Now, the way of minimising bruising is to use a cannula, but a cannula is not suitable for everything, but certainly a blunt cannula makes bruising less likely, but it's not guaranteed. And I think if you want to avoid bruising completely, because you've got a special event coming up, then don't have the fillers done until you can cope with it if it happens. And it doesn't always happen, but it can. Lips can bruise more than the rest of the face, or this area around the mouth can bruise quite badly if you use a needle, because there's quite a lot of blood vessels here. So it's possible to get damage at the injection site from the entry of the needle to anything else that goes on that could cause scarring in its own right. And obviously if you're having that treatment to look better, the last thing you want is scarring. It's really, really rare. I haven't seen it personally, but it can happen, and it's just important to know that, obviously. Lumps and nodules. Well, you know, some fillers do have more of a tendency to form lumps and nodules, but I think it's really important that you know that the practitioner that you're working with will inject in such a way as to avoid that if possible. I mean, sometimes it just happens that the filler becomes more cohesive, sticks together, causes lumps. Sometimes it's practitioner error. I use the Restylane range of products, and across that range I find that those are the least likely of all the fillers I've ever used to cause lumps and nodules, and so it's not really a problem that I've had. There are solutions to it, like massage, dissolving, of course. If I tell you in 10 years I've only ever dissolved fillers twice, you know, there's usually a solution to everything, or you have a practitioner who doesn't get many problems to start with. So most of these things have a solution, and that's great. As I've said, the filler being seen under the skin, practitioner problem. A skin rash with itching. Now, I've never seen this, but apparently it can happen. It's almost the body's reaction, overreaction to filler. Now, it's highly unlikely that anyone will be allergic to hyaluronic acid, but it's not impossible. And I say highly unlikely because we have hyaluronic acid in our skin naturally. Having said that, this hyaluronic acid is manufactured in a laboratory. It has other things in it to cross-link it, so it is possible that your body says, no, I don't like it. So they're called hypersensitivity reactions, and you have to be really careful, obviously, that the person that you're working with knows how to handle that, knows how to dissolve filler and solve the problem. As always, I'm saying the same thing over and over again. Blocking an artery. Now, yes, whilst that's a practitioner error, it's really, really serious, and it's not something that anybody would ever want to do. There are areas of the face that are more dangerous than others. So for example, this area here is a danger area when it comes to fillers. You've got two very big arteries that run up here, and some big veins as well. Anything around the eye or on what we call the glabella is dangerous, and if those arteries get blocked, it is possible, very, very small chance, but there have been around 100 cases of blindness around the world. Now, obviously that is terrifying. So I think the answer to that is yes, whilst it's a risk, I don't know why I can't speak today. You need somebody who knows, first off, where those danger areas are, and you need them to take precautions if they're going to inject there. So I think injecting here, there are very few practitioners skilled enough to do that. If they do it, they should be using a cannula. Same around the eyes. So even if you're having tear trough filler around here, you want to use a cannula because you're close to some very big arteries. So that's really important. Obviously you need to be aware of that risk, but it's tiny. In the whole mix of how many fillers there are, 100 cases versus hundreds of millions of fillers is absolutely minuscule. But if it happens to you, it's 100%, and I completely get that. So you just need to, again, make sure you're in good hands. And don't be scared to question, you know, are you really going to use a needle there? Are you going to inject there? Are you going to use a cannula, etc.? The nose is also an area that you need to be really careful of when it comes to this. So for example, if filler is put into the nasolabial fold here, too superficially, there's a very big artery that runs here, and that can get blocked, and the result of that is it can cut off the blood supply to the tip of your nose, and there have been cases where people have lost the tip of their nose through necrosis. Again, very, very rare, but it can happen. Obviously, the result doesn't have to be as dramatic as that. You can lose the blood flow, but not all of it, so you get some necrosis, but the end effect is not quite so damaging as losing the tip. Any injections along the nose can be quite risky because, again, big arteries running all the way up here. So again, nose, you need somebody who really knows what they're doing, can use hyalase in the clinic to reverse the filler if needs be. And they stay central and they stay deep to the bone to try and minimise those risks. I had in 10 years one case of somebody who got some white here as I was injecting. Now, I've developed as a practitioner, and if that happened to me now, I would just dissolve. What I did on the day was I massaged and massaged and massaged to move the filler, and it appeared to work. And it did work, but that patient did actually get a very small area of a very pale redness. You had to look really hard to get it, to see it. And I offered to dissolve it, but she actually liked the effect so much, and the effect had finished by then, so nothing more was going to happen. She decided to leave it. But I've since developed from there, and I think now if that happened to me, I would dissolve, and of course I have it in the filler where I can do this. Broken blood vessels, they can happen, and I have seen that once. Using skin boosters on the cheeks, which are very superficial fillers, so you place them superficially deliberately, you can get broken blood vessels or telangiectasia, that's what they're called. And if those happen, they are permanent, so you would need to have some other treatment to try and get rid of it, like laser. So as I said, I've seen that once with skin boosters in 10 years. Discoloration at the injection site. Now this also I've seen once in 10 years. It was a gentleman. He had quite hyperpigmented skin anyway, and I think that probably added to the problem. So this is where your practitioner making a judgment beforehand about whether or not it's the right thing to do. And he got a tiny little black dot where the injection site was. And again, that's permanent and it would require lasers to get rid of it. It's a risk. So if you're having multiple injections, every time the needle goes in, that would be a risk. But again, once in 10 years, so it doesn't happen very often, although it is listed on the manufacturer's leaflets as a problem. Skin necrosis, now we've talked about the tip of the nose, the glabella area, but anywhere, you inject anywhere with fillers, be that on the leg, the face, the hands, anywhere, and we can do hands and we can do necks, you have a risk of that. So if it's skin, there will be blood vessels underneath it. If you block them, you'll starve the skin above it of oxygen and risk necrosis. So that means the skin above the area can die and fall away. And in really severe cases, that will need plastic surgeons to actually fix it. So that's not ideal. Now, I'm not sure this is actually a problem with fillers, but being able to palpate the filler in the skin, I think in most cases you'll always be able to feel the filler, because if you didn't feel it, it wouldn't be doing its job. But you shouldn't be able to see it, and that's the important thing. You shouldn't be able to see a lump or a sausage of filler or whatever shape it is under the skin. So that's really important. What else can happen with fillers? The lips you have to be very careful of, because they're very vascular, number one, so you can get very bad bruising, but you also can block arteries in the lips quite easily. So again, you need somebody who knows where those arteries are and where they're putting their filler, and to be working in such a way that they can identify problems. If it's placed in the wrong place in the lips, it can migrate outside. So you may have seen people with their lips done where they kind of have a lumpy, swollen area above. And that's filler that's in the wrong place, essentially. So that can happen. You can get these little white dots on the lips as a reaction to filler that seem to stay. I haven't seen it very often, but I have seen it happen. So that's another thing that you have to be on guard for, I guess. You have to be on guard for all of these things. So those really are the main issues that you can get with fillers in terms of risks. As I said, split into two, practitioners or filler. The thing to remember is that in good, competent, medical, safe hands, fillers are very, very safe, and the risk of anything going wrong is absolutely minuscule. So then finally, having mentioned most of the bits and pieces, I guess infection is the real thing to mention. And infection is the biggest risk, I guess, or probably the most common. And that can be because you've got a practitioner who's not going through the right hygiene or safety procedures, or it can just be bad luck that as your skin is injected, it manages to drag in some bacteria with it. And infection can show in a couple of ways. So you can either have a reaction a couple of days later where you start to get red and hot around the area, swollen, painful, and you must speak to your practitioner quickly. They will prescribe antibiotics for you, and hopefully that will be the end of it. However, in a small number of cases, because there is a foreign body under the skin that has become infected, it can develop what we call a biofilm. So it can actually become quite protected from the body, so that when you use antibiotics, they just don't work so well. And that can be quite hard to overcome and can go on for quite some time. And you can use antibiotics. You can try and get rid of it that way, sometimes steroids to calm down the inflammation, but it might be at the end of the day that you need to have the filler removed as well. Ideally, we don't want to do that while you've got an infection, because you don't want to put a needle into an infected area, because you don't want to spread it around. But your practitioner should be skilled enough that they hold your hand along the journey and work through it with you, and find a solution at the end of it. And in an ideal world, you don't get infections because you've got a practitioner who is working in a safe, hygienic, clean way. And I think that's really important. And I can honestly tell you, hand on head, wood, no, I'll touch my skeleton board, shall I? There you go. In 10 years of running my clinic, I've never had an infection. So it's important that we're just all really, really careful and try as best we can to avoid it. So that's my whistle-stop tour around problems today. There are many others, I'm sure, but those are the main ones that you need to think about when you're having fillers. I hope that's helped. If you want to pop over to our Instagram and have a look at the work that I do on there, it's at Non-Surgical Clinic, and all of the work on there is real, and none of the photos are doctored, I can promise you that. So I hope that's been helpful. So take care, and I'll see you next time.